Good morning, everyone. I'm Dr. Manuela Malta, and I'm currently the Global Director for Education and Products for Health Sciences. And I'm so glad to spend this time with you and share this webinar with our Australia team. So welcome to this webinar. Today we will talk about designing learning sessions using the different simulation modalities recommended by the Laureate Learning Model for Health Sciences. But before starting, I would like to introduce you to the FALD team and the FALD simulation team. Here we have Dr. Francisco Gutierrez, the Senior Vice President for Medicine and Health Sciences. Myself, you already know me, and Ana and Gracia, who are part of our Health Sciences team, and they have supported the development of this program. And I'm pleased to introduce you to our amazing FALD simulation team. These are the people who are working hard to develop the standardized materials for our trainings. So every time you have a nice learning experience about simulation in our FALD activities, thank to these people. So I want to introduce you to Carla Rumiche, Coordinator of Simulation at UPC in Peru, Haruki Noshita, full-time professor for dentistry program at UPC in Peru, Dr. Patricia Greff, who is helping us in the chat today. She is the National Academic Manager for Health Sciences in Brazil, and Dr. Daniele Santos, who will be with us very soon in the chat too. She is the National Specialist in Simulation for Health Sciences in Brazil. So this webinar is part of the designer level of our Faculty and Academic Leadership Development Program. And the objective of designer level of this program is to train professors and academic leaders to design learning sessions according to the Laureate Learning Model, methodologies, technologies, and tools. And this webinar is the first activity of designer level. And soon you will receive a package of recommended readings, and then you'll be invited to attend an amazing workshop, very interactive and practical. And I'm sure you're going to enjoy very much this experience. So during this webinar, I will make some breaks to review questions in the chat. So please share your questions or comments in our chat, and I'll be pleased to respond to them. We will also have some of our leaders, like Dr. Patricia Greff and Daniele Santos, interacting in the chat and helping to respond to your questions. So everybody's going to have your questions responded. In this webinar, we will talk about the needs, importance, and golden rules for the development of a high-quality academic documentation and the logic of granularity. We will also share with you what are the Laureate Health Sciences tutorials and how they will help you to develop high-quality academic documentation. We will also talk about our starting point for every single academic document, which are learning objectives. Then we will get more specific to discuss about how to develop skill training sessions and how to develop different simulation scenarios. Okay, everyone, let's start discussing about the needs, importance, and some golden rules for the development of a high-quality academic documentation and the logic of granularity. I just would like to remind you that the objective of the design level for FALD is to train our professors and academic leaders to design learning session according to the methodologies, technologies, and tools recommended by the Laureate Learning Model. So we are going to talk much today about how to design those documents and to provide our students a very good learning experience. We start here with a very important question. What happens when we don't have detailed, standardized, and high-quality academic documentation? When I say academic documentation, I'm talking about all documents that we design to plan our courses, disciplines, and every single learning session and practices. So we have seen some issues when we don't have these documents standardized and described in high quality details. And these issues are about learning sessions becoming likely to be of lower quality, inability to replicate the best practice lessons, best practice learning sessions, because we don't have record of the session. So we cannot share or replicate them with other professors, with other institutions in the network, right? And we have no effective way to control the quality of what happens in the learning sessions. One more issue is if a professor leaves to attend a conference, or if they get sick, or if they resign, we are going to have some troubles to continue the classes. Another issue is about always being going back to the beginning instead of move forward and work on refinements and improvements. Besides that, we are going to have students from different shifts or campuses having different learning experience in the same course or discipline. Or even we are going to have students missing important learning experiences, and definitely we don't want to have this, right? Without academic documentation, it's very hard to track the development of competencies and build a system for continuous quality improvement. On the other hand, when we have these documents designed in high quality details and standardized, we are gonna surely have many benefits. That has to do with the increased quality of the classes, the students and professors clear about their roles in the learning sessions, different students having the same learning opportunities. We are able to track the content's development, and we can share best practices and keep focus on innovation instead of going back to the processes, to the beginning, right? All the time. We have had the experience of improvements in accreditations visits, and because of the high quality academic documentation, the disciplines continue to advancing even if professor changes, and we can also help new professors to implement the methodologies even before they are formally trained. And on top of everything, this is a success factor for the implementation of the Laureate Learning Model for health sciences. So after some years working very hard on academic documentation development, we are able to identify 3 golden rules to develop a high-quality academic documentation. The first one is students at the center of the learning experience. And believe me, this is a huge pedagogical culture change. The professor now takes a different role. They are, in this context, they are facilitators, and the students are now the main characters in the learning process. The second rule is stick to well-designed learning objectives. So we are going to agree, you are going to agree with me that we cannot go anywhere if we don't know where we want to go, right? So the learning objectives are our destination. It's where we want our students to land at the end of a learning session or of a discipline. So every single decision that we take in a discipline, course, or learning session is guided by the learning objectives, methodologies, materials, activities, everything. And the third rule is details are never too much. The high quality details allow the professors to run the same learning session with a very similar level of quality, and the documents become replicable because it's granular. Of course, different professors have their style, have their examples from their clinical and professional practice, but if we have the documents very well detailed, we can offer kind of the same learning experience to different students for the same course. But what do we mean when we say granular? We have here some good definitions of what granular means. Consisting of or appearing to consist of granules, something that is finely detailed. And based on this concept, we created the HEGA project. HEGA means Health Science Granular Academics. This is a set of finely detailed, high quality and standardized documents for every single discipline of a course that gathers in one single document the professional competencies, curricular map, syllabus, session plans, and practice tools. The organization of this document is based on deductive logic. I mean, out, in, from professional competences to the most granular documents. I mean, the practice tools, as for example, a simulation scenario script that will be run in the, I don't know, in the session number 7 of this discipline. To develop these documents, we created the Laureate Health Sciences tutorials to help professors to design high-quality academic documents. But the question here is, what are these tutorials? Let's talk a little bit about that. The tutorials are standardized templates for academic documentation. So we developed these templates to offer clear instructions to guide professors to fill each field. So each field, you're going to find instructions, okay, that are going to guide you to design the academic documents. We then organized these tutorials in a manual of academic documentation design, and this manual is now available in English, Spanish, and Portuguese. We have several tutorials such as syllabus, lesson plans, task training forms, simulation scenarios, and many others. And I would like to invite you to explore these documents as soon as possible. Do you have any questions so far? Let's check our chat to see if we have any questions. Okay, we don't have any questions. I would like to invite you to interact in the chat. If you have a Gmail account, you should sign in YouTube to be able to interact in the chat and share your questions and share your comments. We are going to be glad to go through all questions and comments here. Okay, everyone, let's talk about our starting point. The point where everything begins when it comes to academic documentation, the learning objectives. What is a learning objective? The definition of learning objective is what students should be able to do, to be, or to know at the end of a learning session, a learning experience, or a discipline. When we design learning sessions, we need to start from the learn objectives, and the learn objectives need to be set in one of the 3 domains. Cognitive, I mean the knowledge, psychomotor, which are the skills that students are supposed to develop in this learning experience, or affective, I mean the values and attitudes that they should develop in the learning experiences. The learning objectives have different complexity levels. Also remembering and understanding are listed in this pyramid. We shouldn't stay in this level for much long. We need to aim to the higher levels of this pyramid and push our students to apply, analyze, evaluate, and create things during the learning process. The understanding of concepts will be obviously important to support them to do other things much more complex than this. And one last very important topic here is that the learning objectives are going to define the learning methodologies. we always need to think about the learning objectives as our destination and the methodologies as the road that we'll take to get there. So remember that taking the wrong road, won't take you to the right destination. And so if you want your students to develop the ability to perform a procedure, for example, don't think that they will reach this with a conference. Maybe you are an amazing maybe you are amazing at making a conference, but it's not going to be enough for the students to develop a skill related to a procedure. You need to select a methodology that allows them to perform the procedure until they develop the psychomotor skills related to this procedure. But let's go straight to the point now and talk about how to design learning objectives. When we design a learning objective, we need to start with an action verb. But give me a few moments to reflect with you what means an action verb. What we call here an action verb is something that can be translated in observable behaviors. For example, if you put here the verb reflect, there's no way to measure if your students are reflecting or not, right? We cannot set up a screen in their minds to broadcast their reflections, their thoughts, but we can evaluate their reflections if they discuss, if they argue about some topic, but we are not able to evaluate this in any other way. So we have to start with an action verb, then we describe this specific task. In this case, in this example, we have the verb measure, which is very observable action, right? The task here is measure the patient's heart rate. Then we describe the condition, at rest. So it's absolutely clear what we expect the students are able to do in this learn experience, which is measure the patient's heart rate at rest. When we set up a learn objective, we have to make sure that this is specific. I mean, it's not too big, not vague. It does not left any doubts about what the students need to do, to know, or to be. They need to be measurable. That's why you need to select an action verb. Otherwise, you won't be able to measure if your students reach the learn objective or not. They need to be achievable. I mean, when it must be something that your students at this point of their training will be able to achieve. We cannot set up a learn objective of proposing a treatment for, I don't know, migraine for a middle-aged woman. If your students don't know what migraine is, the cause of migraine, the symptoms, how migraine develops and develops in a middle-aged woman, and if they don't know about the available treatments, the learn objectives need to be relevant. You cannot propose a learn objective of, for example, perform the simple interrupted technique to suture a wound in a diabetic adult or counseling students, right? Because although the learn objective is well written, it's not relevant for counseling students. And finally, the learn objective needs to be set in one of the three learning domains. I mean, cognitive, affective, or psychomotor domain. So let's see some examples here of good and bad learning objectives. Let's think together about what's the problem with teach the students the structure and function of the lungs. The problem here is that this learning objective is killing the golden rule number 2, students at the center. In this objective, the professor is absolutely at the center of the process. It's not saying what students will be able to do or to be or to know at the end of this learning experience. But if we say explain the pulmonary structure and function during the ventilation, we are setting up an action verb. Students need to explain something, which will allow the professor to measure if they understood the topic. There's a task, which is explain the pulmonary structure of the lung, and the condition is very clear during the ventilation. When we say to learn about different suture techniques, this is not specific. There's no action verb, no task, no condition. A learning objective can never start with to learn or to teach. Of course, students are going to learn something, but be specific. When we say perform the simple interrupted technique to suture a wound in a diabetic adult, we have a clear action verb, perform. I mean, we can see the students doing something, right? The task is clear, perform the simple interrupted technique to suture a wound, and there's no doubt about the condition. It's a diabetic adult. But before we move forward, let's differentiate competencies from learning objectives. Competencies are the set of the learning objectives that integrate skills, knowledge, and attitudes which were acquired throughout the disciplines until the end of the course. They're never developed in one single learning experience. This is too big to be developed in such a short learning experience. But learning objectives are set in only one learning domain, and they are reached at the end of a learning experience, a class, or even a discipline. We could compare the learning objectives of a single learning experience, such as a class or a simulation scenario, to the bricks of a building. And the learning objectives of a discipline, of a subject, or something like that, to the columns of this building. And the competencies to the entire building. Let's see an example here. To develop the competence of to act in the advisory and deliberative structures of the health system, establishing new relations with the social context, recognizing the structure, the forms of social organization, their transformation and expressions, we need to reach some learning objectives before, right? Such as to explain the functioning of the health system and the nurse's role in the organizational and managerial context, and others. Do you remember that we just talked about learning objectives as the destination and methodologies as the road to get to those destinations? Let's see some examples about how to match methodologies with learning objectives in simulation. In simulation, we have 5 different modalities: isolated task training, integrated task training, simulation scenario, interprofessional simulation scenario, and the evaluation modalities, which are OSCE and OSFI. For each one of them, we need to set up different learning objectives. If you want, for example, that your students are able to collect venous blood with a vacuum and syringe system, you need to be aware that this is an isolated skill. So you will select, obviously, isolated task training as a simulation modality to develop this skill. But if I want my students to be able to carry out the venous blood collection procedure, starting with the selection of the collection tubes to send the material to the laboratory, plus inform the patient about all steps of the procedure, I need to know that I'm talking about integrating different skills here. I am including decision-making, including communication. I'm talking about integrated task training. Can I go straight to a simulation scenario here? Yes, I can. But we have learned that putting the students in an integrated task training first before they go, in the middle, right? After they perform isolated task training and before they go to a simulation scenario experience is very beneficial for them. So let's do more integrated task training. Let's offer this experience more to our students. If I want my students to manage conflict during some situation, guide the patient and their families during a procedure and things like that, I'm talking about a very complex situation where students need to put knowledge, skills, and attitudes in action, but working alone. There's no other professionals involved. I'm talking about simulation scenario. However, if I want my students to be able to work in teams, communicate with other professionals, lead an interprofessional team to care of a patient, I need to design an interprofessional simulation scenario. This is going to be my selection, right? And if I want to evaluate the procedural skills, I will design an OSPI. And if I want to evaluate clinical professional skills, I'm going to propose an OSCE. So let's make a quick break here to review our chat to see if we have any questions. Okay, we don't have any questions so far. I would like to again invite you to share your questions, to share your comments. If you are having any experiences in simulation and you want to share with us, we are going to be glad to listen from you. Okay, let's talk about how to design skills training sessions inserted in a session plan. I just would like to highlight the importance of having our simulation practices inserted in the curriculum as a programmed activity that will happen for all students in this or that discipline. We cannot let simulation practices to become an event, you know, depending if the professor is a fan or not of simulation. I would also highlight the importance of having the simulation practices inserted in the session plans. That way we know exactly when the practices will happen during the semester or trimester and what professors and students are expected to do during the learning session. As I told you, we have two different task training practices. We have integrated task training and isolated task training. The isolated task training sessions are organized in different stations. And here, each station promotes the development of some part of the entire skill. It's going to cover mainly the psychomotor aspects. Of course, some people questions if we can use task training for other kind of skills that are not psychomotor skills. So of course we can have the task training about, for example, active listening, which is not psychomotor, but we are able to split the micro tasks and create different stations with the different techniques for active listening, for example. So an isolated task training proposes a list of micro tasks, as very detailed step-by-step for each station. Here we don't need to have clinical context included because the focus is to develop the specific skill until the students can do it automatically without thinking much about this. It's like the body learning to do something, as well as we do when we have driving lessons. So our body knows what to do. We don't need to think about to brake the car, about give any signal, because our body knows what to do. We are able to drive and to talk to people in the car, and well, we don't need to think about that, right? So this is the objective This is why we use isolated task training to teach our students' bodies what to do. Finally, in an isolated task training, all students repeat the tasks exhaustively. But when we talk about integrated task training, we are talking about an activity that integrates affective, cognitive, and psychomotor skills. Here, the students need to put their knowledge in action to make decisions, they have to manage their emotions, and to perform a procedure. You are probably wondering if it's not the same that happens in a simulation scenario. Well, kind of. But here, differently from a simulation scenario, students have a checklist of macro tasks, okay? We have micro tasks in isolated task training, very detailed for each task, step by step. And in an integrated task training, we have macro tasks. So instead of detailing step by step of collecting venous blood, the checklist in an integrated task training will look like this. Greet your patient, introduce yourself, check the patient's personal information, explain the procedure, ask for informed consent, select the collection tubes, take our actions for patient safety and hygiene, perform the collection of venous blood, identify the tubes with the patient's information, prepare the material to send to the laboratory, check if your patient's feeling well, give them additional information about what to do next and the precautions they need to take, and close the encounter with your patient. Here we assume that the student already developed the skill of collecting venous blood, take the actions for patient safety, the skill to identify the collection tubes, and everything. The integrated task training do require clinical context, and there's no need to our students to perform exhaustively. Everybody's going to perform once, maybe twice if you have time. And while one student performs the entire encounter with the patient based on this checklist, the other students take other roles and follow the encounter with the checklist, and they can also offer some feedback to the colleague as well. In a test training document, we have some critical elements. The learn objective, our starting point, the materials for the practice, instructions for the students, a description of the demonstration phase when the professor demonstrates the task to all students, the checklist for each session is station, and the closure of the session. We're going to talk specifically about each one of these topics. When I talk about learning sessions, we are talking about, when we talk about learning objectives, actually, we are talking about what the students will be able to do, to know, or to be at the end of this session. We cannot propose more than 3 learning objectives for any learning experience. It would be too much. And anything more you put there is going to be too much. For each station, we will have 1 learning objective, always oriented towards the higher levels of learning domains. When you describe the materials, please be specific. Don't put only gloves, okay? You need to be specific about how many gloves, how many needles you need, how many mannequins, for which station. This is very important for the success of this learning session, okay? Always be very specific and go to the details. In the instructions to the students, you need to be clear about the dynamic of each session. Are they going to work in pairs or in groups of 3 or 4? So they need to perform the procedure in a table or a bed or on the floor. You need to be very clear about the dynamic of each session. Be specific about the demonstration. What kind of demonstration will be offered? The professor will be performing the procedure or the task, or they will show some video. It's very important, okay, that the demonstration is explained. So while the professor is demonstrating, he's explaining each step. And it's important that the students have some time to clarify doubts before starting the practice, and then they mediate feedback while they are practicing. For an integrated task training, the difference is that you will probably propose only one station, and the station has a clinical context, okay? Maybe you have more than one, but usually you have one station that gathers many skills, many tasks, macro tasks that the students are going to perform. Let's talk about the checklists. The checklists are something very important in the task training document. And when you design the checklist, remember that they are very important to allow students to practice autonomously. So the more you detail your checklist, the more students will be able to have an autonomous practice. So use images, videos, because they are going to help the students a lot. As we mentioned before, in an isolated task training, you have the step-by-step of each procedure or task. I mean, it's a detailed list of micro tasks. In an integrated task training, we have a list of expected actions, which is a list of macro tasks. And here is a very important tip for you, okay? As we are all professors, we already have all these skills in automatic mode. We don't even think about them, about the steps. So that's why sometimes our checklists are not the best, because we are so used to perform some tasks or procedures that we forget to write important steps that students didn't know yet. So my tip to you is go to the lab with a colleague or with an experienced student, perform the procedure or the task, and ask other person to help you to write everything you're doing. This is gonna help you a lot to have a very good to design a very good checklist, very comprehensive checklist and detail. Finally, to close a task training session, we need to propose some activity that will allow us to evaluate if students reach the learning objectives. And you can propose different things, okay? Practical activities, a rubric, discussion, quiz, depending on, obviously, the learning objectives, which are our starting point for everything. Let's see here some example of good and bad descriptions in a skills training form. Let's see here the first example. Know the steps of taking vital functions. The learned objective here is not good because it's not an action verb, and because in a task training session, students need to perform something. Then a good objective here would be perform the taking of vital functions in an adult patient. We already talked about describing materials and be specific. Note that to the left, we have a non-specific description, and to the right, we are more specific about the materials and their quantity. The same detailing we see for the instructions. It's not enough to say practice will be done in pairs. You need to be more specific about timings for each phase, how many minutes the professor is going to have to demonstrate the procedure, and how many minutes the students are going to have for each task, when they're going to rotate, and everything, students and professors are expected to do in each moment of this session. And to close our conversation about task training sessions, remember to plan the activity in a session plan. In this document, the goal of the task training should be covered. The methodologies must be coherent with the learning objectives, because maybe you have simulation, the task training, and other methodologies, and you need to put it there. Specify where each activity will take place, and describe what students and professors are expected to do in each moment of this learning session. When we talk about lesson plan or session plans, we need to have in mind that the students need to be at the center. So planning the students' activities, ensure that the students are gonna get involved, are gonna be active in the learning session. Okay, everyone, let's take a minute to review the chat. Let me see. We have a comment from Jane Jaworski. Sydney Nursing has been using simulation scenarios since the workshops were held in Australia. That's so great. Thank you very much, Jane. I was very glad to be with you in Sydney and to be with our colleagues in Melbourne. And it was a very good experience. And thank you so much for putting it in practice. Okay. I think we don't have more comments or questions. No. Okay. Let's move forward. Okay, let's talk about how to design simulation scenarios inserted in a session plan. Let's start differentiating simulation scenarios from interprofessional simulation scenarios. It's very important here to mention that all simulation scenarios will cover behavioral skills. Simulation scenarios must cover soft skills, okay? This is the moment when our students are gonna develop leadership skills. They're gonna know their emotions better. They're gonna learn about how to establish relationship with patients and this kind of stuff. So remember that the psychomotor skills should have already been developed in a task training session. So in a simulation scenario, you can surely bring the discussion about the procedural skills to the debriefing, but the focus here is the management of the entire situation, relationship with the patient, emotions control, empathy, humanization, communication, and other that are connected to behavior. However, when we are in an interprofessional simulation scenario, the discussion will be focused on the interprofessional relationship, leadership, teamwork, and this kind of soft skill. So we are not going to bring a discussion about the procedure itself, because it's not the objective. Of course, you can question your students if a team were performing a procedure together and something went wrong. You're not going to discuss the step-by-step of the procedure. You're going to discuss about what happened with the communication, with the teamwork, with the leadership in this scenario that resulted in a bad performed procedure, right? In a simulation scenario, we have only one student performing in the one or two students from the same profession performing in this scenario. And in an interprofessional simulation scenario, we will have students from different professions performing and professors from different courses facilitating the debriefing. So these are the main differences between a simulation scenario and an interprofessional simulation scenario. When we design a simulation experience, we need to have in mind that we can use 4 different resources. Standardized patient interactors will perform the role of patients, clients, or anyone who will be attended by the students. Virtual reality with haptic devices or virtual patients, mannequins, or hybrid scenarios that gathers actors and mannequins together. Again, here, the resources will be selected based on the learning objectives. Okay, let's talk about the document. Okay, the document for simulation scenario planning has 10 critical elements that you need to take much care of. The first one, of course, the learning objectives, the materials needed, the environment layout, the scenario description, mannequin setup, expected actions and consequences, participants, actors briefing, students briefing, and the highest moment of the brightest moment of a simulation scenario, which is the debriefing. Now let's talk in details about those elements and the step-by-step to develop a simulation scenario. The first step, as we already talked many times in this webinar, is setting up the learning objectives. You can ask yourself something like this. At the end of this scenario, the students are going to be able to do or to know or to be what? A very common mistake here is starting from the case. For example, I will design a simulation scenario about a patient with food intolerance. Then you develop a very interesting case, but it won't be useful because you don't know the destination where your students should land at the end of this experience. You can start from, at the end of the scenario, the students will be able to diagnose food intolerance in an adolescent with symptoms of lactose intolerance. Great. We know where we want to go. Now you can develop a case that will really help your students to get there. So this is the first step, okay? Please don't start anything without setting up a very good learning objective. The second step is when you become a script writer. This is the field that we call scenario description in the tutorial. Here you will describe a case in which condition the patient arrives, what do they request from the professional, medical history, what is expected from the professional during the encounter with the patient, etc. You need to be very specific, who participates, where does it happen, if it's in the office of the professional, in the community, in the hospital, what's the case, what should be done by the professional, everything. The third step is to make the environment realistic. These are the fields that we call environment layout and materials needed. Here you will describe the environment in details and try kind of recreate the space that really put the students immersed in the experience. You need to remember that simulation is an immersive experience. The students, when we design a simulation scenario, we want our students to forget that this is not real, because emotionally, cognitively, and in all aspects, it's very, very real. So to offer immersive experience, we need to start from the environment, you know? The materials that we need to have in the scenario to make it realistic. So put pictures in the document. It's gonna help a lot to the people from labs to set up the environment for you. Also be specific about the materials needed. We already talked about this. You don't want your students to not be able to do something in this scenario because the materials are not available, right? So think of everything. Think about the real environment where a professional is going to perform with a patient. Well, the fourth step is to make the scene realistic. This is the field that we call expected actions and consequences. And I would like you to pay much attention in this field, because one of the beauties of a simulation scenario is that the student receives immediate feedback about their performance from the scenario. You don't need to tell them that they didn't do well, because if they're doing good, the patient is gonna get better, is gonna be more collaborative, or is gonna calm down, or this kind of stuff. But if the student makes some mistake in the scenario, the patient may become angry or more anxious and say that they're not feeling listened, for example. So it's important to define each action expected from the student in the scenario. So I expect the student introduce himself, check for the personal information of the patient, ask about this and this and this. So you are gonna develop each action expected from the student. Then you will describe the mannequin setup or the reaction and speeches of the actor if the student does what you expect. So this is going to be a feedback for the student that they are doing good, right? But it's also very important to plan the reaction of the mannequin or the actors if the student do not perform as expected. Remember to plan the turning point in the scenario. The turning points are those moments where the scenario may take one or another route. You can plan some actions, okay, from mannequins or actors to put the students back on track or not. It always depends on the learning objective. But you have to have in mind that the scenario, at some point, the scenario it's a very important point, because at that point, the scenario may take one or another route. So you need to plan very well this point, because this is going to be the turning point of the scenario. The fifth step is defining the participants. How many students will perform in the scenario, from what courses they are, how many actors and their roles. Also, you need to indicate if the patient will be an actor or a mannequin. This is very important, because you need to know how many students, how many actors you need, or if you need mannequin or something like that. The sixth step to plan is the actor's briefing. Here you need to describe all personal information about the character, current and past medical history, information about their families, how they will behave in the scenario, if they will look nervous, collaborative, sad, or angry, the appearance, right? How they should dress for the scenario is very important as well, to create a realistic environment, a realistic experience. And always remember to write an instruction that say that the actor should read the following fields: scenario description, expected actions and consequences, and actor's briefing. So it's going to allow the professor that's going to run the scenario to deliver the document to the actor, to train the actor, to try the scenarios sometimes with the actors, and make sure that the actors are going to be on track, are going to do what you expect them to do. But I would like to tell you that simulation scenario is a document that we are going to review many times, okay? So don't worry if in the first time things don't happen as you expected, because we are never able to imagine everything that the student could do in this scenario. So this is nice because we can learn from every single experience, and we can improve the document for the next experience. Talking about the seventh step, it's about describing the instructions that should be offered to the students. This is also very important. Here you should remember a very important rule. The students need to know exactly what they would know in the real life, and always connected to the learning objectives. If this is a first appointment with a new patient and the objective is to explain to the patient about the role of a nutritionist, you should say, okay, you are a nutritionist, and we received today the patient Andrea Coleman, and for the first time. She has some doubts, and you have 10 minutes to clarify her doubts. Don't forget that the instructions should cover some important topics. Who is a professional? I mean, you are a nutritionist, a psychologist, a nurse, traditional medicine professional, anything, you need to be clear. Where they are, in a hospital, in an office, in the community, where they are. What should they do? And here, it's very important that you don't say too much. You just tell them enough. So if you want, for example, the students propose a diagnostic hypothesis, you're not tell them that this patient has migraine, okay? Because it's, or cancer, because the objective of the scenario is that the students are able to propose diagnostic hypothesis. So the students have to evaluate the exams, the lab tests, perform a physical evaluation, and then propose the diagnostic hypothesis. But if we want our students to communicate something, communicate a diagnostic, we can tell them, okay? We can tell, okay, you're a nurse, and this patient has this and this and this, or you're a nutritionist, and you need to communicate this diagnostic to the patient, okay? And probably we're gonna put something hard to manage, the patient's gonna cry, is gonna get very scared about the diagnostic, this kind of thing. So depending on the learn objective, you are gonna say one thing or another thing. And then tell them how much time they have. I just would like to remind you that a simulation scenario can take from 5 up to 15 minutes, okay? So why we don't go to 20 minutes, 25 minutes in a simulation scenario? Because after 15 minutes, your students are gonna lose attention, they're gonna lose the learn objective, and remember that a scenario is very specific about something. They need to do something very specific, they need to manage a situation very specific, and they're gonna have up to 3 learning objectives, and that's it. So set up the objectives, 5 up to 15 minutes for your students to perform in this scenario. And you can give some additional information to the observers. So maybe you want the observers to pay attention to how the professional demonstrates empathy to the patient, but you don't want your student that's who is going to perform the scenario to know that the main objective is about demonstrating empathy. Okay, you're just going to tell them that they need to give some orientation or instructions to the patient, and there's going to be a hard situation, much pain coming from the patient, and the student needs to demonstrate empathy. So you give one instruction for your student that's going to perform the scenario, and different instructions for the students that are going to observe the scenario. Finally, when you are done with everything, you need to plan the debriefing. This is the start of simulation scenario experience, because at this moment, the students are going to reflect about the practice, are going to reflect about the learnings, and also remember that if the students don't reach the learned objectives in the scenario, they are going to reach the objectives during the debriefing. We have worked with two modalities of debriefing, which is structured debriefing, when you have around 35 students in the group, and plus and delta debriefing when you have larger group. When you plan for a structured debriefing, always remember the 3 phases. And remember that the 3 phases are is going to propose, each one of these 3 phases is going to propose different questions, because the objective of each phase is different. In the first phase, description and reaction, the objective here is promote awareness. Awareness about what happened, what I did, and about the feelings experienced here. In the second phase, we are going to promote the reflection about the practice. And in the last phase, we are going to promote the insights of learning. So in the first phase, description and reaction, you need to start designing questions like, what happened in this scenario? What was the case attended by the professional? And asking about what was the case helps much the students to keep focus on the description, because when you just ask them about what happened in this scenario, they are likely to respond something like, what happened was that the patient was anxious, the professional was scared, was clear or not. They're going to start evaluating or judging, the performance. But when you ask about what was the case attended by this professional, they're going to say it was the case of a middle-aged lady with migraine, and she is experiencing these symptoms over the last 10 years, and he looked for the nutritionist to get some help. And the nutritionist did this and this and this. The nutritionist offered this and this instructions, suggestions, and proposed this and this and this. Then ask about the feelings. How did you feel? How do you think these feelings influenced your performance? And also remember to indicate that all students should be involved in the discussion. So clarify that the questions should be addressed to all students, not only the students who perform in the scenario. It's very important, okay? The second phase is analysis and understanding. The questions here should allow the students to make connections with the real life, identify the strengths of the professional performance, reflect about the learning objectives, and finally, identify opportunities of improvement. A very nice tip here is to design the questions addressing the professional's performance. It was not Carla, it was not John, it was not Anne, Kath, who perform in the scenario, right? It was the nutritionist, it was the counselor, it was the nurse who performed in the scenario. So building the questions like this, you allow the group to do not put all focus in the person who performed in the scenario. So remember to use positive words. You can start asking about, do you think is a common situation in the real life for this professional? Because in this phase, we need to start making connections with the real life, okay? Then you can ask about which were the strengths of the professional performance in this scenario. Then you should be more specific in your questions connecting to the learning objectives. For example, can you describe the protocol using in situations like this or other similar questions? And finally, you can make them to reflect about the mistakes, but using a very positive questions. For example, if you were going to attend this patient again, what would you do differently? You know, so with this question, you are leading the students to think about what went wrong, but you don't use negative words here. And the last phase, synthesis and evaluation. The plan here is to lead the students to identify the lessons and how this experience was valuable to their professional lives. You can propose questions like, which lessons are you taking to your professional life after this experience? Or how did this experience contributed to a better professional performance, for example? If you are designing a Pleasant Delta debriefing for more than 35 students, it's much simpler and it will be focused on the strengths and opportunities of improvement. So very simple questions like, what were the strengths in the professional performance, and then what should be done differently? I mean, what could be improved in this performance? We highly recommend that you propose both options in your document, so the professor who will run the scenario may make the decision based on the numbers of students participating in the debriefing. When you are designing an interprofessional simulation scenario, you need to remember that learning objectives are related to soft skills. In the briefing of the students, you need to clarify that they will work in an interprofessional team. You need to be clear about the expected actions for each professional, and ensure that the questions in the debriefing will address interprofessional topics. Okay, but we also have a session plan here where we need to insert this scenario experience. And in the session plan for a simulation scenario activity, you need to plan the timings for every activity and the total time for the session, because maybe you have other methodologies in the class, so you need to plan the entire session. You need to obviously set up the objectives of the scenario, and the objectives of the scenario have to be connected to the objectives of this class. You need to describe the methodology. which may be only simulation scenarios or in the professional simulation scenario, or include other methodologies such as gamification, snowballing, KWL, and many other jigsaw group, and many others methodologies that you can put along with the simulation scenario in the same learning session. And you need to describe in details the expected activities from professors and from students. Remember that here we need to put the students at the center of the learning session. We need to make them more active. We need to make them move in the class, in the learning session. Of course, you need to plan the resources required and plan how to assess if the students reach the learning objective. So you have a learning objective that needs to be reached at the end of the session, and you need to plan an assessment strategy to evaluate if the students reach the learning objectives. So let's check our chat to see if there's some comments or questions. And we have a comment from Team Trivial. We have the first of our simulations planned to run over the next few weeks in Melbourne. That's so cool. I'm so glad. Please share with me. I'm gonna be glad to see your experiences. And if you need any help, please let me know, okay? And another comment from Ashley, and he says, agreed, Jane, the sessions were fantastic. Thanks again, Manuela. The great news is that there are many new faces here today to enjoy the presentation for the first time. Thank you for sharing this with me, and welcome to the new faces. Welcome to the ones that I don't know yet, but I'll be pleased to know you, to meet you, and the next opportunity in Australia. So we don't have any questions and any additional comments. Please, again, feel free to share your questions, your comments in the chat. We have our colleagues from Brazil responding to some questions in the chat. So please feel free to share with us your comments, your questions. Okay, once you have the culture of simulation well implemented as a learning methodology, it's time to plan the use of simulation for assessment. In the field of assessment with simulation, we have two modalities: OSPI, when we want to evaluate practical and procedural skills, and OSCE, for when we want to evaluate clinical and professional skills. OSCE means objective structured clinical examinations. It evaluates clinical and professional skills in an structured and objective examination. It also evaluates clinical and professional reasoning and professional competencies. When we talk about OSPI, it means objective structured practical examinations, which has the same structure and objectivity of an OSCE, but it aims to evaluate practical and procedural skills. In any of these examinations, the students rotate through stations in which they have clear tasks to complete. In each station, we have one or two evaluators to observe the students and using an objective rubric to give them feedback. So to run an OSPI, we may have one station or more, at least one, obviously, but for an OSCE, we may have 4 or more stations. And the most critical success factor for this kind of examinations is, first of all, to have the culture of simulation implemented in the course. Because it's not fair to evaluate students with a methodology that's not the way how they learn, right? So every time I'm facilitating a workshop or talking to people about OSCE, about simulation, people get so excited about implementing OSCE, OSPE, because everybody gets excited about evaluation, right? But we need to remember that everything needs to start from the way that our students learn. So if you don't have the culture of simulation as a learning methodology, remember that it's not fair to use OSCE and OSPE to evaluate these students. The second thing that we consider as a success factor for a good OSCE or OSPE is the complexity of the stations. You don't need to have 18 stations as described in some publications. If you have 4 stations very well designed in a high complexity levels. So if you have 4 stations very well designed in high level of complexity, you can evaluate the students in many aspects. Procedural, clinical and professional, behavioral, everything, because the stations are very complex. So the objectives of each station must be very clear, and the rubrics to evaluate the students' performance should be of high quality, very objective and detailed. So it is what makes OSCE and OSPE an objective evaluation, because we have a rubric, very objective, very clear about what we are evaluating, and we translate everything in observable behaviors, so we can be very objective, and we somehow take the subjectivity of the evaluators when we have good rubrics. And finally, the logistics and the preparation of this kind of examination is paramount. So when we are designing an OSCE or an OSPE, we need to remember that we should propose maximum 3 objectives per station, and be very clear about the standards for actors and mannequins. Also plan the quantity of materials to start and to replace during the exam, and finally develop clear instructions for the students to complete the tasks in each station. So remember that the instructions should be coherent with the learning objectives, brief, but offer enough information for the students to complete the tasks. Remember that an OSCE exercise or evaluation is very similar to an experience in a simulation scenario. Some people, some institutions are used to give immediate feedback to the students when they are using OSCE and OSPE for evaluation. Just have in mind that we can use OSCE and OSPE for learning and for evaluation. We have used OSCE more for evaluation because the logistics is huge, the preparation and everything is huge. So we are doing many simulation scenarios with good debriefings, and we are saving the OSCE and OSPE for evaluation. But as I was telling you, some institutions are giving immediate feedback to the students right after station. We don't recommend that because a student may get very nervous if the feedback's not good if the feedback don't tell them that they did a good job, and it may have some impact in their performance in the next station. So you can use the rubric to evaluate the student, and some days later, 1 week later, you can share the rubrics with them so they can see where they did good or not. It has been a very good practice that we are implementing in our institutions, and it's working very well. So to ensure that the evaluation will be really objective, you have to design high quality rubrics for each station. This is all about transparency and good feedback to the students, and also it facilitates the classification, the standardization. You make sure that all students are going to be evaluated from the same criteria, right? A good rubric should keep focus on the measurement of established goals, the reference of classification to indicate the performance level. I mean, you have to describe the optimal performance so you can measure the student's performance comparing to this description of the optimal performance. And you have to organize the performance in the criteria, right? In the different development levels. So it may be divided in accomplished and not accomplished, or 3 levels: accomplished, partially accomplished, or not accomplished. Just remember that you have to be very specific and describe very well what each level means. Let's see here some examples of good and bad rubrics. When describing the criteria, you need to be very clear about what is expected from the students as an optimal performance for each criteria. In this example, we see all steps described. I mean, the criteria is ability of something following these steps: 1, 2, 3, 4, 5. It's very well designed, very detailed, and everything. So for accomplished level, we need to describe exactly what we are considering accomplished. Here, we are considering accomplished when the student performs all steps of the technique. It's different to say, as we see in the table to the right, performs the technique. Performs how and do what? So we need to be very specific. Performs all steps of the technique, and the steps are described in details in the criteria. In partially accomplished and not accomplished, we quantify the steps covered, making the evaluation more objective and clear. For example, partially accomplished is when the students perform the technique but skip or make mistakes in at least one step. So if they perform all steps, they accomplished this criteria. If they skip at least one step, it's partially accomplished. But when we talk about not accomplished, we are saying doesn't perform the technique or skips or makes mistakes in more than 50% of the steps. It's different to say does not perform the technique. It's very, it's not specific, it's not clear, and it does not give the students a good feedback. So we finished the presentation, and now I'm going to review the questions. If you have any question, let me see. Sally Metric, this has been so valuable. I'm excited to use in in next week's clinical simulations. That's so good, Sally. Good luck. I hope this webinar have helped you much to design your simulation scenarios. Easter Parker says we have great examples of this process in our clinical studies classes and of course in clinical practicum. However, there's room for some shorter 5-15 sessions focused on specific skills. It's very important, Easter, to keep your simulation scenarios in 5 up to 15 minutes. So it's very important because you make your scenarios more more objective. You make your scenarios more more valuable to your students. Nick says, also, is there a central location we can see or save our simulation documents so we don't have to reinvent the wheel? That's a very good question, Nick. We don't have a central location where we put our simulation scenarios, but the beauty of being in a network is that we can share, we can make contact with our colleagues from other institutions, and we can share our simulation scenarios, and we don't have to reinvent the wheel, as you mentioned. Ashley says, hi Nick, yes, we do have a COP being set up for our Australian team and folders and collating simulation documents. That's very good, Ashley. So we do have for Australia some place to share the scenarios, and it's going to be very good to stimulate you and to help you to move forward, right? And but also I would like to encourage you to reach our colleagues from other institutions in the network and to try to exchange some experiences and to exchange some documents so we can help each other. Nick asks, does anyone have a black scenario form, the one with the blue font? They could send me, thanks in advance. Nick, we are going to share the tutorials with you, with the entire team, and you can use these tutorials to develop your scenarios. So I think we don't have more questions and more comments. So I would like to thank you for having watched this webinar. We are very glad to having you here and to share with you some experience and to be in touch with our colleagues in Australia. Thank you so much for your time. Thank you so much for being here. And I would like to ask you to take some minutes to register your participation in this webinar by scanning this QR code or connecting through this link that's appearing on your screen. And our teams are also sharing the link in the chat. And I would like to invite you to follow us on Instagram. Our Instagram is @Laureate Science @Laureate HSC. So you can explore our posts, our stories. You can see what our colleagues are doing in the network, and you can also share your pictures or your videos by direct message, and we are going to be sharing your contents in our Instagram. So thank you very much for watching, and keep tuned in our Instagram to know more about the next activities. Thank you very much. I'm gonna let this screen here so you can scan the QR code to register your participation in this webinar. Thank you very much.